with you for another insightful episode of the program, Deltawmen Drumbeat. Another episode to educate and inform you. Ama Oneyo is my name.
Education is power that controls success. Do you want to know the principle and educating one on how to apply those principles? Join us on Deltawmen Drumbeat. Deltawmen Drumbeat, the voice for us all.
Welcome back. For the past weeks, we've been focusing on health-related topics, and we ain't done yet. Before we get the show started, do remember you can always call or send your messages to 09032174129, 09032174129. Also, remember to ensure personal hygiene is paramount to the effort to prevent the deadly Ebola virus. Information is key and knowledge is power. Protect yourself today. Now to the business for today. Our topic is prostate cancer. Let us join our guest, second time on the program, the Medical Director, Solar Clinic WARRI, Dr. FOLARIN OJEHOMON. Doctor, you're welcome back to the program, Deltawmen Drumbeat.
Welcome, and thank you for inviting me again.
This week on the program, we've been looking at various kinds of cancer, and it has brought us to prostate cancer. So what is prostate cancer?
Prostate cancer, sometimes called carcinoma of the prostate, is a malignancy of the prostate gland. The prostate gland is found only in men, and it is situated below the bladder, the urinary bladder, in front of the rectum, and it's responsible for making some part of the semen, of the seminal fluid of men.
So what causes prostate cancer?
There's not really any known cause, but there are some things that are associated with it. Most cancers that we have, nobody really knows what causes them. What causes them to become from normal growth to abnormal growth. Nobody really knows, but there are some factors that we have seen that are associated with them. Okay.
So what are some of the symptoms of prostate cancer?
Because the prostate gland is situated below the bladder, when it gets this malignant lump or tumor, as we call it in medicine, it affects your urine, it affects the bone surrounding it, and it affects, because it's involved in the sexual organs, it affects your sexual performance as well. Then if it gets very well advanced, it may even affect your defecation and your spinal cord, which may lead to paralysis, things like that. So basically the signs, the urinary signs are: 1, you may have problem in urinating. You may urinate frequently. You may urinate too many times at night. We call that one nocturia. You may have difficulty in starting to urinate, and to maintain your urine flow. That is the urine symptoms. Now, there's another tumor of the prostate gland we call benign prostatic hyperplasia, which mimics carcinoma of the prostate. So what I've just said about the urine symptoms also occurs in benign prostatic hyperplasia. So the aim is to be able to differentiate between BPH and adenocarcinoma of the prostate, as well as that localized effects on the urine. There's also the fact that once it has spread, it spreads to mainly the bones, mainly the bones of the pelvis, mainly the bones of the femur. And of course, if it spreads to that, you start having bone pains, you may start having fractured bones, you may start having lumps in your bones. If it spreads to the spinal cord, because the spinal cord is involved in the movements of the legs, you may start to have paralysis and weakness of your walking. So those are basically, I've tried to give you the symptoms and signs based on how it affects the organs around it.
So who's at risk?
The risk, well, like they say that there's no really known things that causes prostatic cancer, but there's some risk factors. One of them is obesity. If you're fat, you're more prone to having cancer of the prostate. If there's a family history, okay, now they say that it is known that if you have a first-degree relation, your chances of having prostatic cancer is doubled. That means that if your brother or your father has prostatic cancer, then your chances of getting prostatic cancer is double above the average. There's also age. It is quite uncommon for people to have prostatic cancer when they're below, let's say, 40. The average age of diagnosis of prostatic cancer is around 70. So it's as you get older, your chances of getting prostatic cancer is increasing. Then there's also genetics. It's more predominant in the black race more than the whites. Then the Hispanics, that's people of Spanish origin, is less than the whites. So blacks are at the tops, then the whites, then the Hispanics below. Okay? Then there's also some dietary factors which they have associated with it. They say that if you eat a lot of red meat, that means that your chances of getting cancer is increased. Now, this, when I say increased, doesn't mean to say you eat red meat, you get cancer. No, it's not like that. It's just that the chances are more than the average, the normal in the society. Then there's also, they say that if you take all these statins, these things that you take for lowering your cholesterol level, it's supposed to reduce the risk. Okay? Then there's viral. Viral, there has been some viruses that have been associated with it, but that one is controversial. Okay? Sexual. They say, these are all theories, that if you have more lifetime partners, that means that if you're changing your sexual partners over your life more often, then there's an increased risk. Okay? But on the converse side of that, they say that if you have frequent ejaculations, that means that you are exercising your sexual something more, then it reduces the risk of prostatic cancer. Then there's again, if you start your sexual activities too early, at an early age, there's a more increased risk of getting. Now, all these ones are all just postulations. Nobody really knows. Okay, but through studies, they've associated these factors that I've mentioned to prostatic cancer.
All right, earlier mentioned, you talked about the age range, that it doesn't come at the age, it comes the later age at 70 and not at 40 down to 50, 60. So precisely, can it be prevented?
No, it cannot be prevented. It cannot be. And there are no vaccines for it. Okay? I've told you who's at risk. It's like I said, it's mainly blacks are more at risk than white people, and white people are more at risk than the Hispanics.
But since there are no vaccines, are there tests that one can go regularly for?
Yes, there are a number of tests. Like, for instance, now, like I said, it really occurs below the age of 40. when we say this thing in medicine, there's no hard and fast rule. But when you say rarely, it means that you can usually ignore people below 40. But once they are over 45, it's advisable that you should go for a checkup on a regular interval, at least once a year. The doctor will do a digital examination. Now, when you do a digital, that means that you put your finger into the anus and feel the prostate. Now, if it's enlarged, you now have to distinguish between benign prostatic hyperplasia or enlargement and prostatic cancer. Now, the doctor will feel the prostate and he will see that, oh, the prostate in prostatic cancer is hard. And it's rough, while MBPH is enlarged, but it's soft, and you can still feel the contours of the prostate. That is digital examination. Once you see a hard prostate, stony hard prostate, you know that, oh, this is a likely candidate for prostatic cancer. Then there's some blood tests that you can do. The one that is so prevalent, everybody is that we call it prostatic specific antigen, PSA. Now, it's advisable that once you're over 40, you'll be taking your PSA. Now, if it's below 40 nanograms, 4 nanograms per mil of the blood, then you know that you don't have prostatic cancer. But if it's above 4, between 4 and 10 nanograms, then that's suspicious. Then there will be the need to go do some extra tests to find out whether it's actually prostatic cancer or not. Then you go and do ultrasound. Ultrasound is not the normal ultrasound. It's you put the probe into the anus and it will be directly on the prostate. Then there's more sophisticated tests, which is better, but we don't have it too much here in Nigeria. It's called magnetic resonance imaging. It has gives you a better picture. Okay, and then you'll be able to pinpoint, oh, there's some areas in that prostatic gland that is possibly cancer. Now, once you have seen those, you can now go and do a biopsy, a prostatic biopsy. That means that you stick a needle into prostate. You can guide it by ultrasound, or you can use a magnetic resonance imaging to guide your needle, and you take a piece of the prostate and you go and test it. Under the microscope, the doctor will be able to say, this is prostatic cancer.
So if it is detected on time, is it curable?
No, it is not. But you see, the thing about it, that's why there are lots of theories and advices by the specialists, experts that govern the oncology, the study of cancer. They say that there's not really any need to be doing PSA. That's why, because what it does is that it overdiagnoses. That means that you see if your PSA is high and everybody becomes afraid. But usually, a lot of people have prostatic cancer and they don't have any symptoms, and they die of old age or for some other reasons. Most prostatic cancer are asymptomatic, as they put it. So they are saying, what's the point of doing a PSA? And then people go through the barrage of tests and biopsies, and then starting therapy and things like that. So they say, unless there are some signs, those are theories. There are other people who will give others that once you see it, then you should start taking treatment.
All right, you have a lot. Sorry to cut you there. A lot of persons we found in this part of the world turn up, to the hospital at, difficult stages. I'll call it advanced stages of ailments.
Yes.
What are the chances of someone who turns up at the hospital with prostate cancer at the advanced stage?
Well, it depends on what you mean by advanced. If you have seen, you've seen that the prostate is enlarged, the PSA is high, then there's a lot of controversy in management. Some people will say, do radiotherapy first. Okay, radiotherapy can reduce it and may slow the advance. But once you've started radiotherapy, it now makes, if the thing progresses, it now makes surgery more difficult. Okay, so some people will say, do the surgery first. That will remove the total prostate, remove the bulk of the cancer away. Then you now apply radiotherapy. Now, if it is very, very well advanced and it has spread all over the body, of course, radiotherapy, which is a localized treatment, is no use. So you now start with chemotherapy. That means that you give drugs, injections, and tablets that go around the body and attack the cells that are involved to try and reduce it. Those are the possible management of it. Okay.
What would you advise everyone listening to you as regarding this topic?
Well, first of all, if you are below 40, there's no need to worry. Above 40, you start to look at, oh, is my brother having prostate cancer? Is my father had prostate cancer? If those are not, then the chances of you are much reduced. Not to say that it's impossible. Then you do your PSA. That is my own personal. There's some people who will say don't do PSA, but do PSA. If it's below 4 nanograms, you're okay, and you do it every year like that to see if you can pick it up. Okay, that is my advice. If you're over 40, do regular PSA estimation. Then if it is high, then you go on from there. That is my advice for people, anybody over 45, men.
All right, doctor, thank you so much for educating us on this week's topic, prostate cancer.
Thank you very much.
Welcome back. I believe you have heard it all on Deltawmen's Drumbeat. We care for everyone. Our aim is geared towards helping and building the family unit, thereby building our communities, state, and the nation at large. Let us listen to our usual contribution from the public. Doctor, welcome to the program.
Welcome to you. Thank you.
All right, we're looking at prostate cancer. How common is it in Nigeria?
Prostate cancer is very common. It's common in Nigeria. It's only because of our unawareness of this illness in men that it takes most of us unaware, not on the person the cases have developed to an advanced state that should not say, oh, it's so. Advice here would be every man has prostate. Prostate, like every other organ in the body, develops and grows either and can become malignant as it grows. And as such, every man from the age of 40 should try to get an investigation done about his. If you, however, have a history of cancer, prostate cancer in the family, the earlier and the more often you do it, the better for you and the member of your family.
All right, doctor, thank you very much. Connect with us on WhatsApp on 09032174129, 09032174129. You can also call or send your messages as well to that number. On BBM, our BB pin is 7A4FECB9, 7A4FECB9. On YouTube, to listen to previous episode at www.youtube.com/Deltawmen's Drumbeat. And also, you can push your comments on our Facebook page at www.youtube.com/ www.facebook.com/Delta Women's Drumbeat. On Twitter @DeltWomen. You can also visit the NGO's website at www.deltawomen.org. Remember to register for the free entrepreneurial training starting on the 6th to 24th of October 2014. To register, call 09032174129, 09032174129. This opportunity is strictly for women in business. Our talent segment is next. You have the opportunity to exhibit your God-given talent in business, arts, entertainment for free. Call 09032174129 or our BB PIN is 7A4FECB9 to be part of this segment. Tuvie Omasheye with a song titled Forever is on the spotlight for this week. Enjoy it.
You took my pain away. Now my life ain't not gonna be the same. It's the way you came, you wiped my tears away, and you put laughter in my mouth. I go to follow you, they go. I know say where you go, wherever I go follow. Say now you be Baba, nobody else, nobody be like you. Now you be Baba, nobody else, no one be like you.
We can take on this week's episode of Delta Women's Drumbeat. Thank you to my boss, LC Ijorogun Reed, Sarah Kamara, my producer, volunteers of the NGO Delta Women, and the crew of Delta Women's Drumbeat. Health is wealth. Remember to ensure personal hygiene. It is paramount in the effort to prevent the deadly Ebola virus. Information is key. Keep a date with us, same time, same station next week. Amana is my name. Do have a successful day. Bye for now.